good day. This is Dr. Yusuf Mathai of Oregon Health Direct Primary Care. Wanted to talk a little bit about the month of February and its significance with our practice or with healthcare in general. So for those of you who don't know, February is actually Heart Health or Heart Awareness Month. And it's a time when we can talk a little bit about things you should be doing to maintain a healthy heart. Again, it's the one thing, if it stops working, that's it for you. And so we want to make sure that we're able to maintain our cardiovascular system in as optimal shape as possible. For me, this actually strikes a little bit closer to home. A lot of people are actually not aware of this, but I do have some heart issues. They most certainly do not affect me today, but growing up, I actually ended up with strep infection that ended up causing some heart damage, and I had to be on treatment for quite a while. It was about 10 years I was getting treatments to ensure that the damage didn't progress any further, and during those times I was most certainly not allowed to exert myself. So again, heart and heart health is definitely something that rings close to home for me. I have been fortunate enough that I am pretty healthy and doing pretty well, but I'm always trying to keep an eye on some of the things that can affect heart health. The big thing that tends to affect heart health in Americans is actually high blood pressure or hypertension. We tend to call this a silent killer because often it's lurking in the background. Often there are no signs of symptoms of high blood pressure until it's a little too late. But while it's going on, and again, it can be going on for years and years, you actually start to do a lot of damage to your heart, to your cardiovascular system. Usually we tend to diagnose high blood pressure incidentally when somebody comes in for an office visit, coming in for something totally different. We check their blood pressure and find out that it's high, and with consecutive readings we find that it's still persistently high, and that's typically how we tend to find that out. Unfortunately, I have seen cases where you tend to find this out when somebody has already had a stroke or a heart attack or has had some bad outcome. So the one big thing I want you guys to remember is high blood pressure is the thing that tends to cause the most damage. It's also the most easily preventable as far as heart disease and heart prevention. The one way that you can actually figure out one is actually go out buy yourself a blood pressure cuff. Keep track, see what those numbers are. If the number is more than 140/90, definitely give your primary care physician a call. The second way is developing that relationship with that primary care physician or that primary care physician team that can definitely be an advocate for you and your health, can be on your side, and with those office visits, you will usually be able to catch those things. So two things I would like for you guys to do today is one, go out and check your blood pressure. It's usually pretty easy to do. And if it's elevated, definitely give your primary care physician a call. We are still taking new patients over at Oregon Health Direct Primary Care. We would love to be part of your care team. So call us and see why we are different. Our number is 503-506-8500. Thank you so much for listening.